Good evening, everyone. I want to thank the St. Francis Hospital for allowing us to use this wonderful hall for tonight's educational event. Tonight we will be talking about the surgical treatment of what we call clinically severe or morbid obesity. Before we talk about the surgical treatment of morbid obesity, however, I want to talk a little bit of what it means when we talk about obesity as a disease. What options do we have for the treatment of this disease? And where is the place of surgery in these treatment options? We will talk about the different types of surgeries that we offer and the context in which we do this surgery, the programs that we have available. And then last but not least, I will invite two guests tonight that have graciously agreed to come and talk about their experience with weight loss surgery. After that, we will have plenty of time for questions and answers. So let me introduce a little bit our practice first. This is the group of surgeons at the Christiana Institute of Advanced Surgery. Myself, Dr. Wynn, and Dr. Peters are the main bariatric surgeons. Dr. Sam is a general surgeon and a cancer surgeon, but she does cover with us with bariatric surgery as well. As I said, we are general surgeons with an expertise in minimally invasive surgery, which is surgery that is done with very small scars generally. We are a center of excellence, and we have helped two of the area's largest hospitals to become centers of excellence in bariatric surgery. We've done, as you can see, thousands of these procedures, and each of us, the bariatric surgeons, have done hundreds of the different types of bariatric surgeries. We've done over 1,000 adjustable bands since 2003, and we've had very low complication rates. So first, let's talk about obesity. What is it? Well, we define it as a disease of excess fat accumulation. Fat, just like other elements in our body, is a necessary element for our survival. But when the accumulation of fat becomes excessive to a certain extent, then it becomes harmful, as we all know. When does it become a health issue? In other words, how much weight does one have to reach before they can worry about their health? It's actually not a lot. If one goes about 20% above their ideal body weight, that's when the medical problems start to creep up. And to give you an example of that, if we take somebody who may be, let's say, about 5'5" in height, let's say their ideal body weight is 150 pounds. 20% above that is actually 180 pounds. Many people would even think that as being a normal weight for a person of that height. In fact, it is at that level that diseases associated with obesity can start to creep up. It's a common problem. About 196 million Americans are affected, and the number is obviously growing. And then we say about 9 million Americans are affected by something called morbid obesity. It essentially means obesity or weight that has gone out of control, that is too excessive. We talk about morbid obesity when the weight is about 100 pounds above the ideal body weight. So let's go back to our example of the person whose ideal body weight should be 150 pounds. When do they qualify for this definition? When their weight goes to 250 pounds. So 100 pounds over the ideal body weight is a number to remember for this definition purpose. Another way to describe clinically severe obesity is to talk about body mass index. And many of you may have heard that term before. Body mass index essentially is a way of putting the person's height and weight together to come to a number that is called body mass index. What is a normal body mass index? 18 to 25. When do we talk about clinically severe or morbid obesity? When the body mass index is 40. So that's another number to remember. Body mass index of 40. Sometimes the body mass index between 35 and 40 with associated illnesses like high blood pressure, diabetes, sleep apnea can also be considered morbid obesity. The risk of severe illnesses or even early death skyrocket once we reach that level. What causes morbid obesity? Well, I am sure many people will have ready answers for that. The truth is, there is no single cause. It is a number of causes that together conspire to create that situation. Genetic factors, of course, we do look like our parents. There is no question about that. You can have two people who live in the same kind of environment, who eat the same type of food, who have the same type of level of activity, and yet one person may have a serious weight problem, the other may not. Eating habits, of course. Lack of exercise, of course. Do you think it is a coincidence that obesity is a much serious problem in America today than in many developing countries? It's no coincidence. Why? Because our daily life lacks exercise. Everything is automated. The more something is automated, the more we want it. Actually, somebody did a very interesting study a long time ago where they looked at the level of obesity before the invention of the remote control for TV and afterwards. Guess what happened to obesity? It went up. Why? Because before remote control was invented, even watching TV involved some activity. You had to get up, turn on and off, or turn the dial to change the channel. With the remote control at hand, you can control not only the TV now, pretty much anything else in the house. You don't have to move. You drive to go anywhere, you use the elevator or escalator. If you try to walk in Delaware, you get killed. There is no places for walking. So the environment is very, very important.